did they start researching on people to find out the different frequencies of the mind that they later on control through like hate, the sub feelings that hate create, like paranoia, like depression, or fear, or when did they start testing?
I said already that in the conference it was revealed that 1809 the first mind control device was created. 1809. In the beginning, no, come on, somebody's beaming me. 1801, 1801, the first one. So it's over 100-year technology, but officially, papers that I have, is that CIA was starting 52 with the Moonstruck program, and since then they've been going on. But of course, since they published this, so it's, you know, it's way beyond. Whatever we read and is published, that's old news, 50-year-old or more.
Because there was a Norwegian author, Per Aslak Attersvåg. He also wrote about things going on in Ris church, where they performed lobotomy on a lot of people in the mental institutions, right here in Norway. And most people don't even know that there's been things going on in this precious country.
In the psychiatric institutions in Norway, it was in the Times magazine in 1994 that US and Norway used insane for Nazi-type research. And then it was a big article. And I sent it to the committee that was 2002-3 researching the misdoings of things happening in the mental institutes in Norway. And I was there first with the secretary, who was like this, didn't seem to be interested in the information I had. But anyway, I had sent to Professor Strömbull, who was the chairman, some papers, so she invited me for the hearing for one hour. And I told them what I know, and then I said, I just got this pile of papers, which is proof what has been happening. But this is my only copies, I just got them, so can we go and take photocopies? Fine, I went with the secretary, who's a lawyer, and she said, I don't want these, take them. I said, no, this is not for you, this is for the committee. And the committee heard that I asked for the photocopies, but in the official paper of our meeting, she wrote, Luukanen took the papers with her. So probably they never got them. And they came to the conclusion that nothing has happened which is, you know, of abusive type in the mental institutes. Even if those who were involved have said, yes, we did this and this. And now I just, a few months ago, read about a doctor, he's already 90, he said, yeah, we did things like we inserted malaria into the patients, etc. Now, I would think that's very unethical. But that's like with September 11th. You put a government committee to research misdoings, but officially it's only research misdoings. Officially, it's going to be the other way around, upside down. You have to come to conclusions that there's nothing in it. Like September 11th, like the Condon Committee said that there's nothing to research about UFOs, etc. But he said a year before that there's nothing to research, but I'm supposed to come to this conclusion after we have, you know, researched this.
Rauni, you are an educated doctor with a career as a doctor before becoming a writer. What would you say about the chemical injections being used within the psychiatry, also in Norway? What is the purpose? What are the results of these
There's a lot of research.
Injections?
There's a lot of, they put them with force. And there was a Norwegian TV program which shocked me because they said that there was a doctor called Maut in Bergen, and according to that program he got 32,000 crowns per patient when he was using certain drugs on the patients. So some doctors are bought, but it is research, it's called research. You know, there comes a new drug, how do you know whether it has an effect or not? Maybe they've done some animal studies, but you know, that's not enough. So we'll have research. And of course those poor people who are in the mental institutes, they are the objects of research. So you give them drugs, injections or oral or whatever, they become more and more crazy. Some of them commit suicide because of those drugs, because the side effects are, among others, suicide. It's an awful system.
Isn't this some sort of Nazi methods? The Nazi methods also started in mental institutions.
What method?
Nazi,
yeah. I mentioned, Times magazine said that Norway and USA used mental patients with Nazi methods. I mean, it's official, but official paper of the government's committee is that there's nothing. And that was before 75. They didn't research after. I said you have to research after 75 because now we have interest what's happening today. What happened before 75 we can't do anything about it, but we can do something what happens today. No, that's not. You know, before 75 was nothing. Of course, nothing now either.